Welcome students, parents, staff, and friends of Augusta County to Connecting with Augusta County Schools. I'm Eric Bond, and I proudly serve as your Division Superintendent. Please join me throughout the year as we take a closer look at our outstanding division and how we strive to serve every child, every day. Good afternoon, Augusta County families and friends. Welcome to another episode of Connecting with Augusta County Schools. We are very fortunate today to have as our guest Ms.Carol Cash, who is our school health nurse coordinator, Dr. Douglas Shifflett, who is our deputy superintendent, Mrs. Miranda Ball, who is our executive director of personnel, and Dr. Kornegay, who is the health director for the Central Shenandoah Health District. Welcome, everyone, to Connecting with Augusta County Schools.
Thank you.
So the purpose of today's episode is hopefully to be very informative and be very transparent to our families and our listeners as we continue to move forward with our hybrid model in Augusta County Public Schools. Those of you who may not know, our hybrid model consists of bringing in half of our students on a Tuesday, Thursday, and the other half of our students on Wednesday, Friday for in-person learning. And we do have about 27% of our students that opted for 100% virtual learning. As we've done this, because of the worldwide pandemic that we're all facing, obviously there's lots of questions about protocol and procedures and how we mitigate and manage our students as well as our faculty and staff as far as positive cases. I think we've been very transparent in the media and notifying our parents and our citizens on a daily, if not weekly basis about our positive cases and how we're mitigating those and managing those. So we're very pleased right now to have on our show Dr. Kornegay. She is the health director for the Central Shenandoah Health District. Dr. Kornegay, welcome to Connecting with Augusta County Schools.
Thanks for having me.
I guess I want to just ask you to talk to our listeners a little bit about the collaborative efforts between the Virginia Department of Health and Augusta County Schools and how we're managing our hybrid model.
Sure, and I'd be happy to. And I think one thing to mention is that we've been collaborating really since schools initially shut down in the springtime. The planning for the reopening has happened over that long a period of time, and we generally touch base at least once a week, if not more, to review data within the region and within the locality. Recently, the CDC released some guidelines for schools. And I think one of the things that they really emphasize is that you have to have a couple of things in place within the schools, mitigating factors to decrease transmission of disease in order to bring kids back safely. And those things include mask wearing, social distancing, environmental decontamination, hand washing, health screenings for kids and staff. And I think Augusta County has done a tremendous job with really taking all of those mitigation strategies to heart. You combine all of those safeguards that they have in place with careful evaluation of what's going on within the community. And we have those discussions at least once a week, making sure that everybody's in a safe environment. I think the other thing that we've collaborated on, really over several months is when cases do occur. There's sustained transmission of COVID-19 within all areas of Virginia now, so it's not unexpected that we see cases occur within the school. Taking action on those cases quickly and isolating folks who are sick and quarantining close contacts will prevent that chain of transmission from occurring. And I think Augusta County Schools and Health Department have done that really effectively and have gotten off to a good start for the school year.
Well, thank you, Dr. Kornegay. I know how incredibly busy you are, and your time is very precious, and we appreciate you spending a couple minutes with us here with Connecting with Augusta County Schools, and I especially appreciate that collaboration, that partnership, as you said, that we've had basically since March 13th. we do discuss, if not on a daily or weekly basis, our data and making some of these data-driven decisions for us and our school board. So I greatly appreciate you and your team. I know you guys are working incredibly hard in this worldwide pandemic, so we appreciate your efforts and your time and certainly our partnership with you.
Oh, thank you. Same here, and keep up the great work.
Thank you very much. So again, the purpose of this episode was just to get a little more in depth with folks that are directly managing and directing these efforts for Augusta County Public Schools. That being said, Mrs. Cash is our school health nurse coordinator for Augusta County Public Schools. Ms. Cash, tell us a little bit about once our kids get to school, how we start managing our protocol.
Well, the first step is to go through the daily screening questions, and all staff and students do have a temperature checked when they get to school. So I'm going to go over all the questions just so everybody's clear about that.
Sure, that'd be great. Thank you.
The first question is, has the student or staff member had a temperature greater than 100.4 in the last 24 hours? The second question is, does the student or staff have a new cough, shortness of breath, changes in taste or smell, chills, sore throat, diarrhea, and or nausea, fatigue, which means more tired than usual, headache, muscle aches, nasal congestion that is different than usual in the last 24 hours. The third question is, has the student or staff taken any medication to lower his or her temperature in the past 24 hours? We have updated our screening to break the next question down to 2 questions. So the next question, number 4, is, has the student or staff been in close contact, meaning less than 6 feet, for more than 15 minutes with or without a face covering with someone diagnosed with COVID-19? And then our 5th question is, has the student or staff been in close contact, less than 6 feet for more than 15 minutes, with or without a face covering, with anyone who is currently awaiting COVID-19 test results?
So let me ask you about those last 2 screenings, because we've dealt with that a lot. We may discuss that a little bit more with Dr. Shifflett and Mrs. Ball, but it's been our experience that some of the cases we have dealt with have been from the community, not in our schools. And so I just want to stress to our listeners and to our students and faculty that answering those 2 questions is so important, because if you know someone or live with someone that has been tested, you really need to answer yes to that question and stay home. Is that correct?
That is correct. And if they answer yes, then they need to consult with their healthcare provider to get further direction.
Okay.
So after the screening process and after temperatures are taken, as long as the answers are no, then they can enter the building. However, if they do have a temperature with the initial temp check, they will be sent to a climate-controlled environment to have their temperature checked again after 5 minutes of waiting, just to make sure that we're accurate and that they do have an elevated temperature. If they do have an elevated temperature at that point, we take them to an isolation area and a parent will be called to take them home.
And then obviously we want them to go consult with their physician.
Yes.
Okay.
So after the screening process and the staff or student are cleared to go to class, and during the school day, if they become ill, then they will be sent to the clinic for the health services staff to assess and evaluate them. They have protocols in place and assessment tools to help guide them in when it's safe for a student or staff member to return to the classroom or if they need to be sent home. This year, we will be calling families more frequently out of an abundance of caution to make sure that our staff and students are safe. We do want to make sure that families have current and correct contact information in the case that we do need to call a parent or guardian to come pick up a student.
So we've now started our 4th week of school, and can you just give us a general overview? Do you feel pretty good about the screening process and the work of our nurses and our staff as we continue to operate in our hybrid model?
I do feel confident in the protocols that we've put in place, keeping our staff and students safe. Also, I feel like our health services staff, we've been able to answer a lot of their questions and given opportunities for them to learn more about COVID and protocols that we need to follow. And I think they are feeling more comfortable as well in the clinic setting.
Well, thank you, Ms. Cash. Now that we've kind of talked a little bit about our procedures and protocol for the pre-screening and once our students and staff get in the building, I want to shift a little bit now to Dr. Shifflett. Dr. Shifflett, again, welcome to Connecting with Augusta County Schools. I want to ask you now, you're managing our student cases, and as Mrs. Cash and her staff and or our principals and or families communicate with you about students, that may be symptomatic and or resulted in a positive case, I want you to kind of describe to our listeners a little bit about what the next step is in this process and how you start managing and investigating and working collaboratively with the Virginia Department of Health, and what the next process is once we've identified a potential positive case and or positive case. Can you kind of take us through that process?
Yes, first following up with what Carol Cash had mentioned, we would then have a pending case. Sometimes those pending cases are shared to us by the parent, and sometimes they're shared with us by the Virginia Department of Health. So when we have a report of a pending case or a positive case, we definitely reach out to the parents and find out as much information as possible. Every now and then we'll get a community member that wants to report a case. That's not something that we're going to take lightly, but we do have to confirm that report for the accuracy and the original notification that was provided to us. So you look at the Virginia Department of Health, and we have a couple contact people that we can call their cell phones directly, and we work with them to see if it is something that we need to investigate. So at the start of our investigation, we try and identify as much information as possible. We document this on a spreadsheet that is actually shared with about 7 central office staff. This allows us to act quickly if we need to, such as a positive case. We need to hit the ground running and investigate and communicate with our families and staff. If it's a pending case, we have a little bit of extra time. When we identify the student information, we actually look at a certain amount of criteria. The first thing we do is provide a case number to that specific case. We put in a date that it was reported, the school in which the student is attending, because some students may attend a high school and also a governor's school, or a high school and Valley and Career Technical Center. We provide the name. We do have to make sure that we have first, middle, and last name because some of our students are very close in their names. We have their grades. And we also put in the educational model. Sometimes it's reported to us that there's a positive case of a student who is all virtual or virtual every day, and they haven't been in our building, but we still report that and we document it in case there's somebody else they've been with that we have to go back and see if they've been in contact with somebody actually in our school. The others are if it's a Tuesday, Thursday, or a Wednesday, Friday, or all 4 days, so that we can have that information to share with the Department of Health, so when they do their contact tracing, we can give them important information. Another thing that we add is the student a bus or car rider? If they're on the bus, then we have to make sure that we are looking at social distancing on that bus and who they may have come in contact while riding. If they're a car rider, is it with their parents or is it with their sibling? Or if they're commuting to, say, governor's school and they're carpooling from one school to the other. So you have to take a look at those instances as well as the classroom setup and where they may go from one class to the next.
So when you mention contact, can you describe to our listeners what our definition of contact is, which we follow from the guidance of the CDC and the Virginia Department of Health?
So contact is defined that a person is less than 6 feet for a cumulative time frame of 15 minutes. And if that is the case throughout the day, if they spend more than 15 minutes throughout that day, closer than 6 feet with or without a mask, that they have come in contact with that person. That puts them in jeopardy of catching the virus, and they would probably be tested or at least quarantined, and that would be followed the direction of the Virginia Department of Health, the local health providers. So they use that for everybody, staff and students, including us. That's the guidelines. So we need to stay away 6 feet away from each other, and we won't be on any contact list. The biggest thing that we actually put on our spreadsheet is the circumstances of how the contact may have happened along with the symptoms. We need to know exactly the day that the test was given, the day that the symptoms arose for the student. Where were they? Were they at school when this happened? Was it at night? Was it over the weekend? Were they at an event somewhere with their family, another city, another place? That gives us information that we can share to the Department of Health because they need that not only for school evaluation, but they may have to broaden their outreach and to find out what happened maybe at a different county or a different event that does not correlate with Augusta County schools, but it may hop over to a different school or a different family or somebody else. So we provide as much information in detail to them so that they can do their job correctly. Now on that spreadsheet, we do have a little check down list. So if somebody is either testing positive or a negative test or a pending test, and sometimes we actually have not tested. We also track the number of days that they've been out of school, because this will help us communicate with the family. Because even though they may be quarantined or they test positive, we have to do a couple of things. One, we need to make sure that they're getting the proper care so that they're safe, that they're helping not spread the virus. But two, if they now have to become a virtual learner rather than a hybrid learner, we need to put those steps in place so that the school administration, the counselors, and the teachers can provide those educational settings and an environment for them to be successful during that 14-day quarantine. So not only are we doing something for the health reasons, we're also doing something for the educational reasons to keep them being successful. I will point out that a lot of this detail comes from counselors, parents, administrators, and there's calls back and forth probably within a whole hour trying to trace back all this information. We gather all that information and contact either Dr. Kornegay or another contact person at the local health department. We give them the scenario that we have. Sometimes they provide additional information that we did not know, such as maybe another student that maybe has come in contact from a different school division or somebody in the family. And we put all that together, and a decision is made by the local health department of whether a person needs to go get tested, whether they're on a contact list, whether they need to be quarantined, and for how long. Because we don't decide exactly who needs to get tested or who does not. We provide the information so that the local medical physicians or the health department can provide that information to us. And the best thing they can give us is when do we start to quarantine and when do they finish their quarantine? Because that's not something that we decide. We actually take that information from the Department of Health after cooperating with them. I will tell you that at that point, we start talking as a central office staff to see what communication needs to be sent out and how it needs to be sent out. We do have some templates that are put in place to speed up the process, and we've used these in about 6 or 7 different schools right now, and we change these accordingly because sometimes there is limited exposure in a positive case. If it's limited exposure in a case within our school, then we would directly talk with that family, let them know that their student has come in contact with somebody that was positive, and then we'll take those steps to help protect them medically and help them educationally. The other times we have researched back that we had a positive case, it was out in the community, it did not come into the school because they either sat home and quarantined themselves before they came in, or they may have had symptoms at school, but reaching back and looking with the amount of social distancing and proper mitigation procedures, that the student had 0 people on their contact list. And that's what we strive for. Even if a person is positive or a pending case, if they can keep their contact list down to 0 or just their family members, then we can stop the spread and we don't have to have teachers or staff or students have to go home and quarantine. So that's the biggest thing that we practice and preach, is that we want to maintain social distance of greater than 6 feet. So that if we do have a positive case, that we have 0 contact people on the list so we don't have to call and contact those families. We do provide letters out to the principals because we feel the principals have a great relationship with their community. And those principals then reach out to the communities and let them know exactly what's going on so they know that we are researching everything, providing the proper information to them just like we do the Department of Health, and being as transparent as possible so they can make decisions as a family as needed. That is a lot that we do. That happens in with about an hour and a half, and sometimes we scramble around because we are notified maybe at 2 o'clock. And we have to get all this information as fast as possible to get to the families, hopefully before the student gets home. We like to notify the families of the students as soon as possible so they can have accurate information. So when their young child comes home, they'll be able to explain something if they need to.
Well, thank you once again, Dr. Shifflett. We appreciate your efforts and all that you're doing to help manage our student side of things. I do now want to pivot to talk about our staff a little bit. So again, welcome Mrs. Ball to Connecting with Augusta County Schools. Just to remind you, Mrs. Ball is our Executive Director of Personnel, and during this COVID situation we're living in right now, she is managing and directing our faculty and staff as far as potential cases and or positive cases. So welcome, Mrs. Ball. I guess my first question that I want to ask you is, I think we manage our positive or potential cases with our staff and faculty very similar to the way Dr. Shifflett described with our students. But if you can kind of maybe touch base on that a little bit and some importance of what we're dealing with on the faculty staff side of things.
Sure, thank you. One of the primary differences between what we do with staff and students is that we are very aware as soon as one of our staff members becomes quarantined or needs to stay home because of potential exposure or signs or symptoms. Obviously, with our staff, our teachers, we have to find coverage for them, substitutes or coverage within the building so their instruction can continue and their work with students can continue. So we identify immediately when they're not at school and if it's potentially related to COVID. And one of the first things principals do is contact me, and we talk about the timeline of exposure, the timeline of test or symptoms, and do that 48-hour look back, just as Dr. Shifflett explained, so that we can be sure that we are aware and are attentive to any potential close contacts that that teacher or staff member may have had within their school for the 2 days prior. We obviously want to limit that as much as possible, but we certainly want to be ready to notify individuals. If that particular staff member ends up testing positive, we want to notify potential contacts so that we can work on mitigation efforts with them. We spend a lot of time talking with our principals, who in turn spend a lot of time talking with their staff and faculty about the importance of social distancing and doing everything possible to maintain at least 6 feet difference between them and their students or colleagues, and definitely for that less than 15-minute time period when it is necessary to be a bit closer. So once a staff member is at home, then we ask them to follow the direction that they receive from either their healthcare provider or the Department of Health related to testing and quarantining or isolating, depending upon the circumstance. Again, we're always referring to those healthcare providers for that direction. We support our employees through their time off by implementing the Families First Coronavirus Response Act, which means that their time away from school or their job responsibilities when related to COVID is covered. So they're not using their accrued sick leave, personal or vacation leave in most circumstances. So that's another reason why we do a lot of documentation and conversation from very early on.
So let me go back to one point you made. I think is very important. Obviously, we don't want anyone to be sick, and obviously we don't want anyone to have to quarantine, but kind of the difference between, as Dr. Shifflett said, a student that may be on a contact list and have to quarantine, there's a possibility there we can set that child up as a virtual learner. Contrary to that, if a staff member or a teacher has to quarantine because they've been identified on someone's contact list, that quarantine could be, anywhere from 10 to 24 days potentially, usually 14 days. But that could be problematic as far as the management of a building and not having enough staff to be able to fulfill some of those teaching responsibilities if we do have several staff members that are out being quarantined.
Exactly. So substitutes are short in normal times. Definitely in this current school year, substitutes continue to be a challenge as far as obtaining coverage for classes. Additionally, we're asking a lot of our support staff to be involved with new roles and responsibilities related to our employee child care, to daily health screenings, things of that nature. So they're not as easily available to cover for a teacher who may need to be out as perhaps they would have been in previous years. So when we look at circumstances that result in multiple staff members having to be out for significant amounts of time, that becomes a huge challenge to being able to keep our schools open and have not only supervision, but obviously ongoing instruction for our students.
So I don't think we can stress that enough. Again, we don't want anybody to be sick. We don't want anybody to have to quarantine, but the success of our hybrid program and the success for us to be able to continue with in-person instruction is really going to rely on all of us doing our part to maintain 6-foot social distancing at all times, especially our teachers and our staff members.
Absolutely. What I can add is that the communication process that Dr. Shifflett described related to notifying school communities when there's a student positive case is very similar in the instances when we've had staff members who test positive for COVID. So our principals are distributing that information to the faculty and staff of the school, as well as families in the larger school community, in the same manner as we're doing when we have students who are positive as well. It's important to be transparent. We're making great effort to do that, and to also provide detail related to possible exposures in the event of a teacher who's positive, to give reassurances when we have successfully limited those exposures as well.
And those exposures have been limited in large part due to the efforts of our teachers and our students. I think they've done an excellent job so far of maintaining that 6-foot social distancing, so that if there is an individual, whether it be a student or staff member in our schools, our quote-unquote quarantine list really hasn't been that extensive at this point.
Yes, we've had limited lists, limited to none, in all of our staff situations to this point.
Well, thank you, Mrs. Ball, and thank you again to all of our guests. We appreciate everything that you're doing. One of the more popular questions I get as superintendent is, what is going to be the decision or the guidance that we have if we have to either close a classroom or close an individual school, or maybe even have to temporarily close the division down because of an outbreak? And that's not a definite defined number. Again, as Dr. Kornegay said earlier, it's a collaboration between the Virginia Department of Health and Augusta County Schools. They are data-driven decisions, and those decisions are going to be made on a case-by-case basis with the guidance and direction and recommendation of the Virginia Department of Health and Dr. Kornegay's staff. So there may be an instance that we have to quarantine just a class in one school. There may be a situation where we have to quarantine an entire school and close that school down. Hopefully it'll never come to this, that, if we do have a spike or a severe outbreak in Augusta County schools, that we may have to close the division for a time period. But those decisions, again, will be made on a case-by-case basis, and again, in strong consultation with the Virginia Department of Health and our local health officials. I do want to remind our listeners that we as a division do have to respect the privacy of the affected individuals, whether it be student and or staff, and we cannot disclose a lot of details about those individual cases. One thing that we didn't necessarily discuss, that we as a division promptly and thoroughly do clean and disinfect any infected space in accordance with the CDC and the Virginia Department of Health guidelines. Also, I would like to encourage and continue to encourage our parents and students and employees to be safe, to monitor their own health, and to stay home when they are sick. And please check with your healthcare provider, your physician, if signs or symptoms of COVID-19 are present. Lastly, before we end, I do want to continue to remind our folks of our mitigation strategies and how incredibly important it is that we continue to do these, not only while we're at school, but when we're out in the community. And not just us that are part of the school community. Our community as a whole needs to take the mitigation strategies very seriously. Again, this is an effort to keep our in-person hybrid model going. So again, please, I can't stress enough, we need to pre-screen before we come to school. If you are feeling sick, please stay home. If you do come to school, we do require that you wear your face coverings. And not only wear your face coverings at school, but we encourage you to wear your face coverings in the community. 6 feet social distancing at all times. Again, whether you're at school or whether you're in the community. And wash your hands frequently. If we continue to do those mitigation strategies and continue to take care of ourselves and take care of each other, I feel confident that Augusta County Schools can continue in our hybrid model and continue having students in our schools for in-person instruction. Thank you again for listening. We appreciate all our efforts out there as we continue to live through the COVID pandemic. And again, all of us working together, I have all the confidence in the world that we can continue to shine as a school division. Thank you again. Make sure you subscribe to our YouTube channel to get updates on our latest episodes. Our episodes can always be found on Augusta County Schools' Facebook page and website.